Hello, I am Dr. Sourabh Patwardhan from Nandadipai Hospital, PG Institute and FECO Training Center, and in this video I'll be speaking about a case of subluxated lens, and I had some issues while handling the CTR. So this is a young patient, history of trauma, nystagmus is present, and there is subluxation, and patient has a very poor glow because of the density of the cataract. The central part is more dense, as you can see here, not allowing any red reflex from there. And the first mistake I committed here is that I decided to rely on the red reflex, which is very poor in this case and particularly in the central region, and I did not stain the capsule, and I realized it the moment I started the Capsulorhexis. Though I could faintly visualize the flap, but still I could not actually see the edge of the flap, and now I was struggling with visualization. So despite knowing that there was a poor red reflex, I did not stain the capsule. That was my first mistake. And then I decided to go ahead with the forceps, because in forceps you can grab and re-grab for lesser attempts and complete the rhexis. That was my plan, and I thought that I have completed the rhexis now. Again, this was mistake. Then I thought that I should confirm whether the Capsulorhexis is okay or not. So I decided to wash off the viscoelastic. I have used viscoat, so it's difficult to wash out, so you have to actually aspirate it. But the moment I started aspiration, I realized there was a free flap or the tear of the Capsulorhexis which was there, which I could not visualize before. So now I have used hyaluronate over the capsular flap, which I could see very faintly, and then again I use the Capsulorhexis forceps to complete the rhexis. So I think, despite knowing that I'm going to have trouble with visualization, I did not stain the capsule. That was a big mistake that I did. Of course, you can always cover it by washing off the viscoelastic and staining the capsule again. Because of the subluxation, you can see there is a temporal weakness of zonules. Luckily, it is not as extensive as I thought. So I thought that I will support this lens with CTR, and that should be more than enough. So I started inserting the CTR, but look at my left hand. I was not supporting the CTR, and obviously it is stretching over the Capsulorhexis, as you can see in the upper part of the video. And now, despite knowing that it is not going in the bag, just watch how it is looping around in the sulcus area. It's not going in. I decided to just let it go. I think, despite knowing that this was not the right place to leave it, I made this another mistake, and obviously the CTR is not in the bag. It has gone into sulcus, and because of the poor visualization of the Capsulorhexis margin, I am not very sure whether one end of it is inside the bag or not. But then now I realize that I have to go ahead with removal of the lens so that I can see better with red reflex. And again, another mistake I committed here is that despite having the subluxated area, I did not support it with capsular hooks, which I should have done. Luckily for me, the subluxation was not very severe and might have been slightly supported by the partly in the bag CTR, and I could remove the soft nucleus with just aspiration. And now this is the scenario. Now I can see the pear-shaped Capsulorhexis here, indicating that a part of the CTR was in the bag while part was lying in the sulcus. Now I have to get the CTR back from here. I cannot put another CTR because it is going to jump out again from the bag. So the clue was that notch of the pear-shaped rhexis where the CTR will be going in the bag. So I lifted it from that side. This was a good maneuver, and I tried retrieving it out of the sulcus, and I should have continued rotating this CTR out of the bag. But another mistake that I committed over here is I tried to use another forceps but released the CTR. The forceps which was holding it up, I released it. Luckily, the CTR which came out went into the angle rather than into the sulcus, otherwise it would have been lost CTR into the sulcus. And now I could grab the eyelet and rotate the CTR out of the sulcus here. So I was lucky not to lose this CTR into the sulcus, but I think I made series of mistakes here which I should have avoided. Now for the second attempt of CTR, it is important. Now I am showing that I have to push the CTR down into the bag while I am pushing the CTR. So using both the hands is important. You can also use CTR injector, and then don't release it until you are sure that you are placing the CTR in the bag. So at the end the result was good. I placed 3 PCIs supporting the haptic on the subluxated area, but I think I could have had complications because of the mistakes that I committed during the surgery. Thank you for watching.